The information provided is not intended to be a substitute for advice given by a qualified medical representative.
Hello there. We are Operation Immunization. Today we'll be talking about important immunization facts and information for you to know for this flu season, vaccination myths, and COVID vaccine updates. First, we will talk about why the flu vaccination is more important than ever this year. Measures that help protect us against COVID-19, such as social distancing, wearing face coverings, and washing hands, also decrease the spread of the flu. The pandemic is causing a depletion of medical resources and limiting the ability of healthcare providers to care for those who are seriously ill. COVID-19 and the flu also share similar symptoms such as fever, chills, fatigue, body aches, and coughs. So, this could lead to testing shortages for those who may need to get tested for COVID-19 due to catching the flu.
Even without a pandemic, you should be getting vaccinated every flu season. Flu vaccination can keep you from getting sick with flu and reduces the risk of hospitalization, prevents chronic health conditions such as chronic obstructive pulmonary disease, diabetes, and cardiac diseases. It helps protect women during and after pregnancy, and getting vaccinated yourself may also protect the people around you.
Here are also some myths about immunization that were proved wrong with trial-based evidence. Vaccines do not cause autism. None out of all of the millions of major studies conducted to test this hypothesis was found to have a link between vaccines and autism. Recent research provides evidence that autism develops in utero well before a baby is born and receives vaccinations, thus proving that vaccines do not cause autism. For those who believe that vaccines contain unsafe toxins, only trace amounts of toxic chemicals such as formaldehyde, mercury, or aluminum are used in FDA-approved vaccines, and there is no scientific evidence that the low levels of these chemicals in vaccines can be harmful. In fact, according to the FDA and the CDC, formaldehyde is produced at higher rates by our own metabolic systems.
For those who believe that vaccines can cause the disease it is trying to prevent, the mild symptoms that may occur does not indicate an infection. In fact, in the small percentage, less than 1 in 1 million cases where symptoms do occur, the vaccine's recipients are experiencing a body's immune response to the vaccine, not the disease itself. Some important vaccinations you should be aware of to check if you are in schedule for are flu, Tdap, pneumococcal, and Shingrix.
Vaccine recommendations change at least yearly, so we recommend that you contact your healthcare provider if you have any questions or concerns. So, COVID vaccine, when will it be ready? Most experts think that a vaccine is likely to become widely available by mid-2021, about 12 to 18 months after the new virus. Considering that a vaccine would normally take years, if not decades, this is very impressive. Scientists are optimistic that if trials are successful, then a small number of people, such as healthcare workers, may be vaccinated before the end of the year.
Please feel free to come to Operation Immunization Virtual Intervention Mondays by leaving a voicemail at 209-425-2375 or send us an email at uoplungs.vaccines@gmail.com to schedule an appointment to get your questions on immunization and screening answered.